Hey, what's up, everyone? Welcome back to the Fat Muscle Project podcast. I'm John Gorman, one of your hosts today. We got Lisa Franz in the house. Lisa, where are you at right now? How are you?
I'm very well, thank you. I'm in Germany. I arrived a few days ago, and I was just saying I have no jet lag for the first time ever. So I'm thanking the time zone gods for that.
Yeah, we'll have to do a future episode on jet lag and how to prevent it and what it feels like. No one better to talk about that than you because you are definitely our world traveler. But our topic today is a very, very important topic when it comes to testosterone. And we just released, you'll see a link at the very end of this video if you're watching on YouTube, back to our ultimate guide to maximizing testosterone levels naturally. And Lisa, that was a very popular episode. We did a complete PowerPoint lecture presentation on that. So if you guys want to go back and find that in the archives, we just released it, but it spurred a lot of questions. And I've been asked these things many, many times over the years. So we compiled a huge Q&A over testosterone replacement therapy. Now, we talked about boosting testosterone naturally. And at the very end, we talked about, well, let's also talk about testosterone replacement and what it's like going to a doctor and when that applies. So it spurred all these different questions, and we've got a ton here. But I wanted to preface this. And the funny thing is, before this episode even started, I said, hey, Lisa, make sure that you keep me on track and we remind women that this is 100% for you as well. Because I'm a guy and I'll talk about my experiences with it. And even though I coach men and women who are both on testosterone replacement therapy and I know both at a high level, I'll tend to usually gravitate more towards talking about ranges for guys and things of that nature. So Lisa is here to keep me on track and remind the ladies, hey, this is definitely for you. And then Lisa, of course, will ask questions if she can think of anything from our female listeners or our listeners in general. So this is a good compilation here, Lisa. Why don't we go ahead and you take the reins and we'll get started.
Awesome, great. So the first question that we received was, what will happen if I don't get TRT and my test stays low, but I want to do a show?
Okay, so someone that has low testosterone, and I get this quite a bit working with a lot of natural athletes to compete in the natural federations, meaning you can't take things like testosterone, even if it's prescribed from a doctor. And I know a lot of our listeners are not people that are going to compete, right? But I want to answer this in a way to where even if you want to diet and try and get pretty lean and you have low testosterone, so whether you're competing or you just want to diet for summer and get a six pack, for example, right? If your testosterone's real low, this is a massive, massive mistake. The last thing anyone should do with low testosterone is try and diet, unless they are very, very heavy. And there's medical reasons why, like you have sleep apnea and you have all these different things, and you're type 2 diabetic. There are reasons why there's important times to get body fat down to improve insulin sensitivity if your testosterone's low, because you have these other medical conditions that are more important than worrying about your testosterone levels, because you're going to be able to get those fixed with some TRT, right? But if you're someone who is low testosterone, especially low total and low free T, and you want to try and diet, here's what's going to happen. You're going to be under recovered and you're going to lose muscle. And I see a lot of people, they end up just being a smaller version of themselves. And in the last presentation that we gave, I showed a picture of me when I dieted on low testosterone and I lost like 25 pounds, and I wasn't a ton leaner, but I lost a lot of muscle. So your ability to recover is down. Your cortisol is going to go up because of that, and you're not going to look the way that you want. And it's not healthy. Like, you don't want to diet when your hormones are out of whack. So, um, if you're going to do a show, bodybuilding is where you're trying to see who's the most muscular, leanest physique up there, and you have your best look. And this is not conducive to that. That's not bodybuilding. It's body destroying when you diet on low testosterone levels. So big mistake. Just make sure that you avoid it and get your testosterone levels fixed. See that last presentation that we did and try and apply some natural remedies, or go the TRT route. And there's 100% nothing wrong with that, men or women.
Yeah, I just want to add to that or remind people of what you said in the last episode of how horrible you felt more than
Mm.
anything. You like, I mean, taking everything else health-wise aside, you just felt like crap. And then add to that, like the dieting even more and like being super lean where you don't feel great. most of the time at the end of a dieting phase anyway. So yeah, that would be just something that I wanted to highlight on that point also.
We
Um,
have a term here in Missouri, in the backwoods of Missouri, where all of us rednecks live, right? When you feel terrible, you say you feel like hammered dog shit. Now, I don't know what that is, but you feel like roadkill. Like that's another thing. Okay. You just trust me on this. Don't do it if your testosterone levels are too low.
mm, great. Okay, so our next question is, can I start and stop TRT if I want on my own? And what happens if I forget to take it?
Okay. So this is here's the thing. I want to make sure people understand it. We're not talking about bros out there that are taking black market testosterone that they're getting from their gym buddy, right? Like I know there's people listening that have done that, and that's totally fine. Now you're on TRT. This is someone that has a prescription from the doctor. Can they start and stop it on their own? And what will happen if they forget to take it? And this is a really good question. It's important to remember. Once you start taking exogenous testosterone, meaning you take testosterone and you put it inside your body, you stop producing your own testosterone. And the thing is, say you go for 8 weeks and you're now running off of exogenous testosterone, the stuff you're injecting or using through a cream or different methods or a pellet, or pill form, and you're not making your own testosterone anymore. So if you forget to take it now, you're going to run out of that med that you put into your body every single week, and you're going to be running on very, very low testosterone because you're not producing basically hardly anything. So it's a massive, massive mistake. Now, the first part of the question is, can you start and stop it on your own? There are different reasons to stop testosterone replacement therapy. If someone decides, if they're 33 years old and it's a guy and they want to try and have kids down the road, a fertility doctor might have them stop and take things like HCG, and they're going to be a little lower testosterone for a while, but the goal is to try and have a baby. Okay. There's times for that, but should you ever start it and stop it on your own just for any other reason outside of that? Not really. There are times to where if you're on testosterone replacement therapy for a long time, it's like say 10 years, right? That's a perfect example. And the androgen receptors, they start to get beat up. It's just like taking caffeine. Like after you take so much caffeine for a while, you start to not feel the effects as well. So what do? You cut back on your caffeine a little bit so the receptors can freshen up. And then you start taking more caffeine and you feel it a little bit better. There are times where people will either lower their dose very, very low on testosterone replacement therapy, or they'll come off for a short amount of time. Now they people know they're going to feel like crap because their testosterone is going to be low, but it lets that receptor get a break from just being hammered with testosterone, exogenous testosterone all the time. So other than that, you shouldn't really be doing it. I've been on testosterone replacement therapy since September, October of 2019, and I don't come off. I just have my labs done. I'm about 550, which is it's really not even the middle of the range. It's on the lower middle side, but I'm okay. That I'm just trying to be healthy. And I'm on a very, very low dose of 120 a week. So there's really no reasons why you should come off. If you do, you're not going to feel good. Your training's going to suffer, your recovery is going to suffer, and it leads to other issues. And remember, cortisol is enemy number one. So if you're under recovered, your cortisol is going to go up. It's probably going to start to affect your sleep. And remember, it's this whole vicious cycle that we've talked about in numerous episodes. You're going to have issues, and you're not going to have the physique that you want. You're not going to feel like you want. So don't start it, stop it on your own. Once you get it, leave it in.
I think people need to treat this more seriously if they're asking this question. Like TRT, it's obviously it's a therapy, a doctor administered ideally, and you wouldn't come off of any other medication just on your own. Or if you're diabetic, obviously then you get more immediate feedback. But like on any kind of other medication, you also should not just forget to take it. So please be aware of the severity, or like how impactful this actually is, and don't start if you can't be responsible with it, don't start it in the first place in that way anyway. That would be my opinion here.
Yeah.
um but yeah, next question. When should I get labs done when I'm on TRT? How many days after a dose is best?
So this is a great question, and this is something a lot of people make. I did when I first started, right? They make this mistake. So you've started your TRT, and we talked about when to get tested when you're not on TRT, and you just want to check your testosterone levels, which are first thing in the morning. You always want to check first thing in the morning because when you're not on TRT, your levels are going to be highest in the morning, and as the day goes on, your levels naturally drop. So to find out if you have low testosterone, it's always first thing in the morning. Now, if someone's on TRT, this is a little bit different. If you're going to, we'll start with injections, right? A lot of people are taking one injection a week and say they do it on a Monday. Well, you don't want to go get your labs done on a Tuesday or Wednesday or a Thursday, even. You want to get it done the morning of your next injection. So if you're taking one injection a week, you want to do it that Monday morning. Okay. And then you go home and you take your injection. The reason being is as soon as you take the injection, well, your levels are going to go super high through the roof, and then they start to drop as the week goes on. A lot of people that do that and they go see their doctor, some doctors, they don't know, they're just primary care, right? They see those levels and they'll freak out if you went in and got your labs done like on a Tuesday, because they're going to be, oh, your dose is way too high, and they're going to lower it down. If this person would have waited and had it done on even a Friday, but or on a Monday morning, their levels are probably going to be down a little bit lower than what they want, but they're not going to be high. Perfect example. I'll just tell everybody mine. Again, I'm taking 120 milligrams a week, and I did that. I went and got tested on a Monday, and my levels came back at about 490. Okay. I've also done that where I'm 2 days before my injection, and I was somewhere around 550 to 600. So I'm somewhere in that middle range of the upper fives. And my doctor sees that and they know everything is totally okay. That's when I get my estrogen and everything checked. That's the best way to do it. Now, if you're doing 2 injections a week and doing smaller, lower doses, still do it the morning of your injection. Now, if you're someone that's taking the cream, creams are more women take the cream more than guys. Guys just seem to go the injection route because they don't care. A lot of women will take the cream, and that's totally fine. Basically, just go get your labs done. It kind of comes out in the wash, but most ladies are going to take it. For example, they may take it the night before. Just go get your labs done the next morning. Or if you take it in the morning, don't put your cream on and then go get your labs done. Just go get your labs done, go home and put your cream on. So it's a daily administration. So your levels aren't going to be sky high and then bottom out. Okay. Um, Pellets are a little bit different. The doc that you're working with is going to have you come in at certain times to get those measured. I'm not a huge fan of the pellet. It's the last option I think anyone should take, because usually they're in there for about 12 weeks, and what happens is your testosterone levels go up, but then it tends to burn out at around the 9 to 10 week mark. And then you've got the final 2 to 3 weeks where your levels are really, really low. So I'm just not a fan of the pellets in general, but they'll tell you when to come in and get tested. Typically, it's about 6 to 8 weeks after your incision and your pellets inserted. It's about 6 weeks after, and those levels are usually in a pretty good range. And then finally, there's the oral side of things where you can actually take a pill, and that's a daily pill. Honestly, to me, it's just like the cream. Just go in the morning, get your labs done, and then take your pill. So yeah, that's pretty much it on when to get labs done. Just make sure you don't do it, especially if you're injecting too far after an injection. Your doctor will freak out.
Now, as for women, is there any difference in regards to like what time of the month or so if they're still menstruating and when they should be getting tested?
For testosterone purposes, I don't really give them any certain, like if I'm a coach, I'm looking at their labs, right? Here's the thing. I look at clients' labs like this that are on TRT because it tells me where their testosterone levels at and what kind of plan I can build for them, what their recovery's like, right? So I don't want people listening to think John's over here looking at people's labs and they're getting prescription testosterone. I don't alter anything, folks. Like that's the doctor does that. I put the best plan together based on their test levels and their recovery and things of that nature. So when I say that, it's in that context. So what I'm saying is I don't really tell ladies, hey, wait until like 19 to 21 days after your cycle so you're in the luteal phase or anything like that. Now, if we want to look at things like progesterone, yes, definitely. So it kind of goes back to that. But you also want to make sure you get your labs done in regards to when it's the best for testosterone, because you might be in that window for the luteal phase, So you need to make sure you time your injections to where when you get your labs done, you go home and you take your next injection.
Okay, perfect. And on the point of injections, we have our next question here, which is, I heard you can use injections under the skin instead of into the muscle. Is that true?
Yeah. So for people that take a very low dose, such as women, and they are doing injections, you can just inject into the skin. It still absorbs. Now, we all grew up thinking intramuscular is the best, where basically you just, in other words, you inject into the glute, right? And these very, very tiny, tiny doses that women take, you can just put it under the skin, like in the belly, and that's totally fine. And people do that so they avoid creating scar tissue. There's a lot of benefits to it, creating scar tissue. To me, it still doesn't seem like it's going to absorb the same as you put it somewhere where there's blood vessels and it can break down and it can get into your system. But I've seen the labs on it, and it totally is. It's you get good levels out of it. Now, for guys, for someone like me, I'm taking 120 milligrams a week. I don't want to inject all that into my skin. I just go intramuscular and I just do what I do. And I've been doing that since 2019. And it's totally fine. Now, there people can microdose. So here's what I could do instead of taking. I do 2 injections a week, but say I was doing one a week. Instead, I could break that out into 7 day a week micro injections, and I could do that in the skin. I could do it in the muscle, but every time you pierce the muscle, you're going to cause scar tissue. So I don't want to inject 7 days a week into a muscle for a decade because let me tell you, scar tissue's a pain in the ass, literally, pun intended, to get past after you've had to do it for a while, or inject or scar tissue anywhere, right? If you're doing it in the shoulder or anywhere else. So it does save you there. So micro injections. And by the way, your test levels stay way more stable the more often you can inject. Most people just don't want to have to do that. They don't want to have to stick a needle in their body every day or 4 to 5 days a week. However, people wanted to do the math and break it down.
Gotcha. Right. Next question. I hear about people using anti-estrogens, but my doctor didn't mention that to me. Should I worry, and what should I look for to see if I need that?
Yeah. So this is typically most guys will run into this. You don't see a lot of issues with women, but if testosterone levels get too high, you'll see conversion. Excess testosterone will start to convert into estrogen, right? And that's where you see guys they'll get hit with it in the chest and they start to develop breast tissue, which is not what a guy wants to do, right? And there's all kinds of health concerns with high elevated estrogen with cancers. You just don't want that. And some people react to testosterone differently. I am a very estrogenic type person. It seems to be if my testosterone levels get even moderately in the upper parts of the range, my estrogen will just go very, very high. So my doctor put me on an anti-estrogen. Arimidex is the standard. I take a half tab twice a week, and my testosterone levels are right in the middle of the range, but that keeps my estrogen levels right in the middle of the range. So for example, ranges go all the way up to say 40 on a labs. Mine are right at 22 all the time, which is right in the middle, and it's perfect. It's not too high and it's not too low because you want to be careful there too. And I feel great. Everything is running the way it should, but some people are going to have a little bit higher estrogen. So make sure when you get your first labs after you start testosterone replacement therapy, you get things checked like estrogen. It's very, very important. So, um, I see a lot of people start off the standard dose that a lot of doctors start guys off, for example, and then we'll talk about women's. Guys will start off at 200 milligrams a week. I'm sorry, but I see that's like definitely for performance enhancement. Most guys do not need that much. And people that might be listening that have taken black market anabolics for a long time, they're like, yeah, but I've taken 500 a week. Well, that's because it's black market and you're probably not getting 500 a week. That's just the truth of it. When you get something actually from a pharmacy, and it's medical grade, 200 milligrams a week is rocket fuel. And I see most guys' test levels, they're going to go up to 1,000 or more, and that's typically when I see their estrogen get too high and they have to take an anti-estrogen with it. Now, most people are fine with that. They want to run super high testosterone, manage their estrogen, and they want to push those limits. Hey, that's between you and your doctor. I prefer to be in the middle of the range, but I still have to take an anti-estrogen. Now, females, I see a lot of people starting them off at 10 milligrams a week. And I have looked at so many labs and I've seen, and I've had so many of my clients, they're women and they're older and they've either had a dieting history, they can't get testosterone up, menopause and all these different things are hitting, right? For some odd, for whatever the reason, they've had to start testosterone replacement therapy. And anytime I've seen them start on 10 milligrams a week on the injection side, their levels have been way too high. They've had side effects. They've had hair growth. They've had the voice change. They've had clitoral enlargement. They've had all these different things, right? And 10 just seems to be too high. I'm a big fan of starting off on anywhere from 3 to 5 milligrams a week for women, and I've seen their levels much more within range. They're still going to be a little bit high because the levels go to like 4 to 60 at the top end for most women, right? Nanograms per deciliter. 3 to 5 milligrams of testosterone a week seems to get them somewhere between that upper range of like 50 all the way up to 100. But a lot of females are okay when their labs come back at 100 because they're not having any side effects. They feel great. And a lot of it has to do with timing and when you get the labs done. So there are going to be times that it's over 100, but there's also going to be times it could be under 100. It just depends. So back to the question with the anti-estrogens, I don't see a lot of females that have to worry too much about this. It's the guys. It's almost always the guys, in my opinion.
Yeah, that makes complete sense in the way that you described it, and yeah, particularly as what we want, what we don't want. Um, so the next question here that we've got is HCG necessary when I'm on TRT?
Yeah, so this definitely is for the guys out there. What happens when you're on TRT for an extended amount of time? Your scrotum is going to pull up in you. Like here, we're just gonna get all up in here, right? We're gonna get serious for a minute. They tend to pull up, right, and it can make things uncomfortable, especially when you're having sex. It's just the other thing it affects is ejaculation. It affects semen, and it affects all of this stuff. And if you're trying to also have a kid at some point, HCG can be one of those things that a doctor will implement if you're trying to go ahead and have a kid. Either you lower your dose, or I'm sorry, you completely come off and take HCG and try and get your body producing again, so your fertility rate starts to go back up. Or if you're somebody that just wants to try and negate some of those side effects from TRT, HCG can be a great tool to use. It's not something that you have to take. It's not something, me personally, I don't. I've taken it a couple times just because I'm getting so many years in, just to alleviate some symptoms. But it's not something that that your doctor needs to have you taking all the time. So if you're taking say 200 milligrams a week of testosterone, you're taking an anti-estrogen. This isn't another thing to where they're like, hey, I need you taking HCG. It's more for like the personal choices and to combat some of the sides. So it's not something that I think I don't see a lot of people doing it unless they have the very specific reasons for it.
Well, it's good to know that there is a way to alleviate those potential symptoms that might pop up here and there anyway.
Yeah. Yep, definitely.
So next question. I'm having a hard time getting my doctor to take my low testosterone seriously. My test is 320 total and I feel terrible. Any advice on things to tell him or ask for?
Yeah. So this is a guy's testosterone levels, but women, we're going to include you in this as well. So anyone that's low running on the lower end of the range. First of all, we talked about these in the last episode, what the ranges are. So females, you may not be clinically low. Guys, you may not be clinically low. Like 320 is not clinically low, but 290 is. That's the bottom of the range. Sometimes a doctor will see these ranges, or maybe you're a female and yours comes back at 12, right? That's still very low. Like you're at the lower end of the range, but you're not quote unquote clinically low. So a lot of primary care physicians, we also don't need to harp on them too much because their primary care, they don't all deal with testosterone. They don't all know it. Like sometimes you have to get referred out from your primary care to a very specific person, like an endocrinologist, for example. But usually, if you just talk to your primary care, you need to tell them the symptoms that go with your labs. So, for example, if you're a guy and your testosterone is 320, you're not clinically low, or you're a female and it's at a 9, but you're not clinically low. What you need to do is and you know there's no way to fix it, and you're interested in testosterone replacement therapy, you need to tell them the buzzwords that make them pay attention and listen. Because remember, they're doctors at the end of the day. They want to hear symptoms. They want to see these different things because that's their job, is to treat these things, right? So the following is, and you are going to be feeling these anyway. So I'm not trying to give someone a whole script to take in to lie to your doctor. Okay. Like these are the things you should be feeling, but you have to relay these. Low testosterone, it comes with low sex drive. Like that's the first thing. Almost everybody feels low sex drive. Some people feel a little bit more depression, anxiety, very low motivation. You feel under recovered, and your training is just suffering. Your sleep is suffering. There's all these different effects that if you go in and tell your doctor that you're feeling those, and then they look at your testosterone levels and they see their lower range, and you say, hey, listen, I think I'm a candidate for testosterone replacement therapy. Can we talk about this? If they say no, because you're at a 320 and 290 is the bottom of the range, you need to ask him to refer you out to a specialist. Because remember, that's their specialty. It'd be like, Lisa, if someone came to us and they're like, hey, I need help with training, nutrition, and supplementation, and I'm trying to have a baby and do all these things, and I want you to work with me through pregnancy and make sure that I'm XYZ. Well, and I don't know if you do this or not. I typically don't. When someone gets pregnant, I either put their plan on pause, or I refer them out to somebody that specifically writes diets, nutrition, and all that stuff for someone when they're pregnant, because that's not what I do. It's the same thing with the primary care, right? You need to get referred out if they're not someone that feels comfortable talking about TRT. I go to the VA because I'm a veteran, and I've been through 4 doctors there because my primary cares, they won't even touch it because they don't understand it. They don't deal with it. Finally, I got a 65-year-old lady, and she does bioidentical. She does pellets and everything in a clinic outside the VA. And she goes, "Oh yeah," she goes, I'll handle this for you. I'll take it over. So now I don't have to go to my doc outside the VA. The VA is handling it because I found the right doc. So sometimes it's just, you just have to surge, and it can be frustrating. But remember, primary care, like if they don't deal with it, they're not bad people. They just don't know.
Yeah, I really actually like this question because I think it happens more than we think that people fall on kind of deaf ears, or as you said, they just do what's within their realms, and they work off of more or less of a checklist. And if you don't necessarily mention all these symptoms, they just see this borderline number, which is still within the range. So hypothetically, they're doing their part. But yeah, find someone who actually listens to you, and like you mentioned, describe all your symptoms. Like if you tend to forget these, or if you just have a short window with your doctor, I almost suggest like going in there with a list of things that you put together prior, where you're like, a couple of nights ago, this and that happened, and I was feeling horrible here at work, and blah, 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 blah. And then they're like, oh, they have actually got some examples written down and like very specifics, so they actually start to listen. But yeah, I
Yeah.
think you pretty much answered that next question, which is, um should I try to find a different doctor if he doesn't listen to me, or should I just go to a TRT clinic?
So the thing is, there are online clinics. I like to recommend my buddies. Advanced Vitality HRT is owned by Jason Theobald and a few people. And I have so many clients that go there that their testosterone levels low. They're suffering, like they don't feel good. Like, they're basically sick, and they can get help. You can go to Advanced Vitality HRT, and if or TRT, if you want to put their name in, Lisa, we'll put their link into the show
Yeah.
notes. It'll be in the description on YouTube. They're a high quality online clinic, and they help so many of my clients that need help. They're so good. I can't recommend them enough. So there are places like that, and you can search them. They're probably in your area. um, are there some places that are super, super bro? They're super bro. That's why I always tell people, I'm like, hey, I recommend, and I know this is kind of leading into our next question. So if we want to save the bro doses for what I feel are more medical and healthy doses, we can talk about that.
Awesome. Yeah, because yeah, the next another question that we had here, let me look for it. Yeah, what sort of starting dose would be common for men and women? And I think you kind of touched on it with like 200 would be quite high, but what would be a common dose?
So I want to talk about the different levels of doses and what I've seen prescribed from doctors when it comes to what you want out of not just your health, but your physique. Okay. So we'll start off if someone listening wants to be very, very muscular and they're a bodybuilder or they just want that look all the time, 200 milligrams a week for a guy is it that dose is going to really, it's going to get you there. Now, those of us that have been on TRT, we understand that people that have been running, um, black market anabolics, they're going to think 200 sounds extremely low. And it goes back to what I said earlier. It's because you're using black market stuff that's not pure. It's not made in a pharmacy. It's getting cut down. The raws from China were probably cut before they even got to the United States. Whoever's making it in their house has now cut it down because they're trying to save money. That's just the reality of it. And that's why you're taking 500 and you're getting okay results when there's a lot of people taking 200 and their test levels are way too high. That just goes to show that black market's not the way to go. So 200 milligrams a week for a guy, that's a really good dose, and you can get a lot of bodybuilding. Um, you can get a lot of physique enhancement out of that, right? A lot. Like I don't recommend higher than that. Now for a female, 10 will also get you there. But here's the thing that comes with running 200 or more, or if you're a female running 10, for example, that we talked about earlier, 10 milligrams a week. Sure, you're going to be more muscular. You're going to recover a lot better. You're going to hold on to muscle a lot better when you diet down. Your sex drive is going to be higher. Your training is going to be amazing. The pumps are crazy. If you are a pump chaser, like you're going to love the gym. Let me tell you right now, like it just there's nothing like that feeling. But the downside is you have to deal with things like higher estrogen levels. So now you have to take a med to offset that. Blood pressure, that's a very, very real thing on higher. Now, it's not high, but on these upper levels of prescription doses, blood pressure going up is a very, very real thing. Hematocrit, basically blood thickness, even though it's not blood thickness, but hematocrit on your labs, I see people go up to, higher than 50% hematocrit. And that's when now you have to start donating blood because your red blood cells get really high and your hematocrit, your blood thickness gets high. Well, your risk for stroke now goes up, right? Because you're, you've got issues with those two levels. So now you're taking those higher doses to look a certain way, but now you have all these side effects that you're potentially dealing with, right? Now, if you would drop down to what I consider a middle of the road approach where you can get a lot of things accomplished and still be healthy, for that, to me, guys, it would be somewhere around 150 a week would be a good starting range. And I like to divide that into two doses. Honestly, it's going to be easier to do 80 and 80. So it's 160, right? So around 150, 160 a week. I've seen a lot of guys test levels come back at 800 on that, and they don't have a lot of the bad issues with hematocrit getting up too high, blood pressure, even though these things may still appear, it's not going to be as bad as when you're running 200 or more. Okay. Females, I like to, like I said, five is a great starting base, even though you will see some that run a little bit high on five. I think five is a great starting dose, and then you retest in 6 to 8 weeks. So those are the ranges that I like to recommend, but it depends on what you're wanting to do. Are you going to be as
I
muscular on 150 versus 200 over the next 5 years? No. Are you potentially going to be healthier? Possibly. It really just depends on how you track everything. So go ahead, Lisa. Sorry.
No, I was just going to say, I personally, with many cases, I would probably like to err on the side of caution and thinking like increasing is always, in my opinion, is probably a better option or a better way to go. Like, okay, this wasn't
Yes.
quite sufficient to get me where I want to go. Now I'm gonna up it rather than overdo it and then having to deal with those consequences.
Yeah. I see a lot of people, they start off women 10, guys 200, and they go and they test 6 to 8 weeks later, and they're too high. And now you've got
Mhm.
to deal with lowering it, going, testing again. If most people just start off on five for women, 150, 160 for guys, It's like almost every time your ranges are within the ranges that we want.
Awesome. Cool. Thank you for those specific numbers. I think that's
Yeah.
quite helpful. Um, Next question. What happens if I stay very lean for a few months to do multiple shows? So whether that person's natural or enhanced, maybe we can talk about both scenarios.
Yeah, so there's definitely a huge difference with somebody that's not on TRT and someone that is on TRT. Okay. And now remember, I'm not talking about someone that's using TRT to try and get an edge. I'm just talking about a normal person. We can use you for an example, Lisa. If we've got Lisa over here that's natural, everything is good, and you're in a great place and you're healthy like you are now. And then you've got a twin sister that for some reason needs to be on TRT. Okay. If you were both going to diet and do shows and you were going to stay lean for, a few months, TRT helps keep your testosterone levels up. Where if you're natural and you're dieting, you're trying to stay very, very lean for months at a time, your testosterone levels are going to stay down. They're going to decline and they're going to keep going down the longer you stay leaner than what your body wants. But Lisa, that's taking TRT and exogenous testosterone, those test levels won't drop because you're putting it in your body every single week. So there's a huge difference. And that's how we see, like in the bodybuilding world, that's how we see a lot of people compete for a whole season. We see women stay shredded for 5 months, or they'll do the Arnold at the beginning of the year, and then they'll do the Olympia in the fall, because they're taking, and it's a lot more than just testosterone, by the way. It's thyroid hormones, all these different things to help run their body the way they want to run it, right? So, but for someone that's natural, a lot of people that don't understand performance enhancing drugs or any of these medications, um, they see this and they think, well, I'm just going to do that naturally. And it just doesn't work. And you end up frying your hormones, like literally burning yourself out. So there's a huge disadvantage. Now, should someone that's taking TRT diet and stay super, super lean? On the female side, I'm not a big fan of it. I'm still, if you're going to do a show, do your handful of shows. Don't stay that lean for longer than a couple months. Reverse diet back out, get your cycle back in order, get your body fat back to a healthy level. It still comes down to that. You just don't have to worry about your testosterone tanking because you're now taking testosterone meds. Okay. So for guys, you can get away with it a little bit longer. I've seen a lot of guys just stay a lot leaner on TRT, and that's totally fine. As long as your other hormones don't tank and your cortisol's not too high, and your hunger's not ridiculous and it's making you cranky all the time, like you still want to be at a healthy body fat level, but guys can get by with it a little bit more.
Awesome. Okay, last question. How much DIM and boron do you recommend for men and women to help boost free testosterone?
Yeah, so boron specifically, I like to recommend anywhere from 9 to 12 milligrams daily. It really does a nice job of boosting free testosterone. So we haven't really talked much about free testosterone. We did in the ultimate guide to maxing your test levels at last, and that's about to pop up here on the screen for watching YouTube here very shortly. Um, Boron does a really good job, but you don't want to go too high in boron. So a lot of people, listen, we're bodybuilders. So sometimes we think, well, a little bit's good. I'm going to take a ton. Like we do that with protein all the time. Like guys will be like, I'm doing 240 grams of protein. I'm going to do 350. Like it's really going to help. Well, there's diminishing returns. I've actually seen people get boron poisoning and break out with rashes and hives and things of that nature because they accidentally were taking two products and they got double that. So like 18 to 20 milligrams of boron, they were getting that and they were starting to break out. So it seems like that 9 to 12 range is about right. And then dim, I'm a big fan of 200 milligrams a day, and that's it. Some people go up to 300. Less than that's not really going to yield the results that you want. But if you go and look at the research, 200 is a pretty good standard dose. You just want to make sure that you're not using cheap dim from Amazon. Like get it from a company that either has it in a product or it's standalone, and it's standardized, it's tested, it's done in a GMP facility. Like look at all this stuff on the bottles. If it doesn't have GMP or CGMP or standardized testing listed on the back, it's not a reputable brand. Be real careful with that. So I know companies that offer just off the top of my head, obviously Fat Muscle does and New Ethics does, and all of our stuff's tested all the time, nonstop with COAs. And it's very high quality dim. Like in Hormone Optimizer, they have Estracort. It's just those are two products with enough dim. I believe Estracort has 200 milligrams in it. We have 200 milligrams. So yeah, that on both those sites for men and women, that's a good dose.
Awesome. I like overall, I hope people just hear that number one, the quality is so important. Testing is so important. If you're not content with your practitioner, with your doctor, look for a different one. Keep searching for someone who listens to all your symptoms. John, I just love the way that you approach the whole thing. I mean, like professionally above or professional above anything in the sense of making sure we're healthy. Health
Yeah.
should come before most other things. And I mean, overall, just really emphasizing that this is something that can really enhance quality of life if you do it correctly. And also if it's, yeah, if you take it seriously. I hope that we really made that clear for people.
Yeah, and the thing is, for people watching on YouTube, or if you're listening on a podcast platform somewhere, in the show notes, our email's listed there. Or if you're watching on YouTube and you want to ask a question in the comments, ask a question. We'll get on there, we'll answer it, we'll make sure. And if we don't know, we'll get you sent in the right direction. But on a topic like this, if you want to remain anonymous, just shoot me an email. It's right there. It's right there in the show notes. I don't add you to an email list. I don't do any of that. Like I know a lot of people that are successful do. They try and get people to email me. There's no hook here. Like I can get you an answer. It's only going to take me a few minutes to answer an email. Like I just appreciate everybody watching. And obviously, if you would like and subscribe, if you're watching on YouTube, if you're listening on a podcast platform, please leave us a review. It just helps get our show out. And we do this because we love helping people. That's what Lisa and I do. Like as diet coaches and athletes, like we love helping people, but the more people we can get this out to, the better. So can you think of anything else that we need to talk about before we wrap this up?
No, I hope that was pretty all conclusive for people.
Yeah. Our next episode, what do we have coming up next, Lisa?
We've got a Q&A coming up next, and then after that, I'm going to be talking about how to bring up a lagging body part.
That's going to be in lecture form. So stay tuned for that. For myself and Lisa, we're out here. See y'all.